If you treat people the way you want to be treated, the money will come. The biggest thing is just making a habit of taking care of yourself.
People get indecisive whether or not they want to pursue some kind of a treatment for their teeth.
I never force it on anybody. I just bring awareness to what's going on in people's mouths.
Welcome back to another episode of Thrive Local. Today, I'm joined by Dr. Alice Xiang, owner of Atlee Family and Cosmetic Dentistry, based in Ashland, Virginia. Dr. Alice grew up in Herndon, Virginia, and earned her bachelor's degree in biology from the University of Virginia before completing her dental degree in residency at Virginia Commonwealth University. Atlee Family and Cosmetic Dentistry, which also happens to be my personal dentist, helps patients smile again with same-day solutions like Invisalign, same-day crowns, implants, along with complimentary digital wellness scans. I'm excited to have Dr. Alice on the podcast and talk about what she's doing in running a dental practice and how she helps her patients. And without further ado, Dr. Alice, welcome to the show.
Thank you so much for having me. This is my first time being on a podcast. I'm super excited.
That's awesome. Yeah. Well, it's I'll tell you a little story, and it's about my first time being a guest on the podcast, and maybe it'll break the ice a little bit here getting started. But the first time I ever was on a podcast, I actually wrote down all my questions and sent it to the host and said, "Hey, ask me these questions." And then I printed out all the answers to the questions that I was going to answer. And then we started a podcast, and I actually never even looked at the sheet. And it was just like all this nervousness. And I realized, you know what? We're just having a good conversation, and it's really all there is to it. It's just being recorded. That's the only thing that's different about it. But it's really great to have you. And I do know that looking at your background in dentistry and kind of seeing, I've been in the office. Obviously, I'm a patient. We're going to get into the dentistry piece, but I really want to talk a little bit more about kind of how you got started in dentistry and kind of what led you to. Let's just start there. Like, what led to the decision to actually becoming a dentist?
So back in high school is when I decided to become a dentist, which is, early. It's not when I was a baby, but I did decide on a relatively earlier stage in life. My family had actually moved into a new neighborhood in Northern Virginia, and my neighbors were dentists. So it was a husband and wife, both dentists. They owned a practice together. And I was actually their babysitter. So I was just babysitting their kids. I'm just in high school, haven't decided what I want to do for my life. But something just about being with them, babysitting their kids, the fact that they were dentists kind of just like piqued my interest.
Yeah.
And so I just asked them one day, I'd love to like learn more about dentistry. They needed help. So they're like, yes, we'd love to have you. We definitely need more help in the office. So I was really lucky. I got a lot of good experience. So on all of my school breaks, so like summer breaks, winter breaks, I was always there. So all of my jobs have been dental related, but I really learned a lot. It was really a blessing to have such good experience because it really shaped who I am as a dentist today.
Can you expand a little bit more about like as a dentist today, and like what are some of the values that really are instilled into you that kind of drives a lot of the ways that you run your practice?
Yeah. Yeah, I definitely don't want to be like every other dental office around the street. For me, a lot of people are scared to go to the dentist, and I want to make sure everyone has like a really good experience. So for me, I don't really focus as much on the dentistry. I focus a lot about how to make people feel. Like even when I was um wanting to redo the furniture. I wanted my waiting room to feel like you're being invited to someone's home. I
Yeah.
wanted to have like a living room feel where you're being invited. I don't want it to feel like a dental office with like pictures of teeth. Like no one really wants to see pictures of teeth. You know what I mean?
Right.
So that's how I really drive my practice. At the end of the day, like if you treat people the way you want to be treated, the money will come. Like I'm not super like I have to hit this number every single month. For me, I'm just like,
Yeah.
let's focus on how do we elevate our patient experience, and then the patients will come.
Yeah, it's like sell by serving. It's like when you serve and you treat people with care, it's and there's an attraction to that people naturally want to, and also being very aware, like you said, of going to the dentist. It's fortunately I've never had any like major teeth issues, but so I don't get that kind of fear that comes along with it. But
Yeah.
I do understand that like generally speaking, going to the dentist is not exactly the thing that people get really excited about, especially when you have issues. So I think that really makes a lot of sense, and it's cool that you're being conscious about kind of the environment that people step into when they come to the dentist. It kind of like brings down the stress, the anxiety, and makes them feel a little bit more relaxed, like they're at home, as you said, to the lobby decor that you have, and the coffee machine, which I always hit up every time I come to my appointment. So that's great. I do want to ask you about like one thing I found really intriguing about your story is you acquired Atlee Atlee Family Dentistry around you were 29 years old, and it was a retired dentist, I believe, that was selling the practice that you bought it from. And I would like to explore a little bit more about what that acquisition was like for you in terms of kind of stepping into that ownership, especially when you have, a pre-existing staff. I'm sure the culture was a little bit different in terms of just from the leadership being somebody that's retired. You're coming in younger, fresh ideas, ambitious. Like, what was that like for you?
When the first year was, I would say, definitely challenging. Before I even bought the practice, I actually signed up to work with these business coaches who are
Hmm.
also dentists. I still work with them today. So we do private one-on-one coaching. So every single month we have a Zoom meeting, go over what's going on. I text them all the time about what's going on. So that was very, very helpful. The first few months were definitely challenging because it's hard to manage a new team when you're the new person,
Right.
and they have their way of doing things. So, you have to do things kind of slowly and just kind of gain each other's trust, which takes time.
Yep.
There was definitely a lot of work to do, but I think overall, I just focused a lot on building relationships with those team members because people want to feel like you care about them as people, not just as employees. So I focus a lot on that. I focus a lot on my work team culture, making it a really fun place to be where there's a lot of growth too. Because I think that's what attracts people to my team is that I am very growth minded. I want people to push themselves and learn new skills and, not just do the same thing every single day. And I'm really happy with where our team is now.
Yeah. Yeah, that's something I've recognized about your approach to culture.
Mhm.
I'm always jealous because Becky's like, "Hey, I've got we're going out to some kind of like an outing or something with the team." I'm like, "Man, that's really cool that you got a boss that's treating you like that and creating these experiences that really help forge the bond between team members and culture is so important. Your staff and how they treat your patients. I mean, that's everything in a business. And so that's interesting too about how uh, earning the respect. That was something I picked up on from what you said. It's like you're stepping in these first couple months, you're the new person, but you're also the owner of the practice.
Right. Yeah. It's
And
a weird
it's a little bit strange, when it comes to, yeah, absolutely. Um, So I one question I let's take this as a next question to follow up. Now that you've been a couple years in, what are some things like what would have been some of like the big learning lessons for you now you've been a few years into your practice?
I would say in terms of finding the right team members, I definitely learned, take your time finding the right people on your team. Um, if you have someone who's not the right fit, it can really spoil the team quickly.
Yeah.
Learned that the hard way in my first
Yes.
year. So definitely had some change of team members, which was for the best. But the first couple of times it happens, it's really painful to go through. And
Hmm.
now on the other side, I've definitely learned a lot. So there's a lot of painful things to go through in your first year. I mean, I'm still learning things all the time as a business owner, but
Yeah.
finding the right team members is key.
Yeah. Yeah. It's the kind of goes back to there's like a saying, it's like hire slow but fire fast.
Yeah.
And taking your time in hiring and making sure you get the right person. And
And it's hard post-COVID too, it
yeah.
just seems extra difficult. So, in my first year, if someone wanted to work here, I was like, yes, come on in. And that was
Yeah,
it.
just being very it's almost
Yeah.
like, and I've made that mistake where, you hire out of convenience almost. It's like you have this nagging pain, like I've got to fill this spot, and somebody shows up and they seem they seem like they're fine, and you're like, I don't care, just get in there and get to work, and you just push them in, and then you realize like, oh, this is actually not really a good fit for the business. Um, let's talk about let's talk about marketing. And I know you do a lot on social media, and just as like kind of going back to what you said in the very beginning about how you like to make you do things to make people feel comfortable when they come to your practice. But then there's like the online presence and
Right.
perception through the online presence. And I've noticed looking at your social media that you really put some good work into kind of building more personality around your brand on social. How's that been working out for you? Do you feel like that's made some good connections between the patient, as they interact with your content and kind of how that energy is brought into your office?
Yeah, I've gotten a lot of good feedback on the social media. I had to build it from scratch because there wasn't really any social media presence when I bought the practice. But I think people really enjoy it because they see me as a human instead of like just as a dentist.
Hmm.
So I make the effort to take a lot of organic, like original pictures and videos of the team, showing us having a good time together. I'll show some of my personal life too, just because you don't want to, again, no one wants to see pictures of teeth really, unless it's like a cosmetic case, then I'll post that.
Yeah.
But people just want to see you and connect to you as a person. So I try to, I focus on that. Just I'm a real person.
Hmm.
I am. This is who my team members are. Make it really inviting.
Yeah. Yeah, that's great. I know what you mean. It's very nonlinear, I think, on social media. It's almost like and I don't want to use this word because it's so overused, but like the authenticity, of like how you show up. But it makes a big difference. And when people feel like that they can relate to you and can connect with you, they're more, interested in actually doing business with you. And I would even imagine the retention would probably be there as well. Like it's not only your patient, but you're retaining more because you still feel that connection even when you've left
Mhm.
the office.
Yeah.
So um yeah, that's great. Is there any other things like when it comes to growing a dental practice, like what's the marketing look like for building for dentistry? Like where's the focus there?
So personally, our marketing, I mean, we have the social media. I do Google ads. I do a postcard actually,
Yeah.
around the neighborhood. So I hit the same neighborhoods every month.
Yeah. I've received the postcard. I'm over. Yeah.
Probably receive it all the
Yeah.
time. So in marketing, you kind of just have to show up everywhere.
Yeah.
You can't just focus on one avenue of marketing. You have to just show up everywhere. And I did a lot of Instagram marketing in the beginning as well, just to bring more awareness.
Hmm.
Um, like I even remember I went to like dinner at a ramen place that I go to all the time, and the waiter said, "Did you know that you're famous? I see you on Instagram all the time." I was like, well, I paid for this ads. I'm glad it's working. But yeah, a lot of people would talk about how they see my ads. I knew it was bringing in a lot of awareness to the office.
Yeah.
So that's drawing people in. I've had some new patients come in just from Instagram. I bring my dog to the office.
Yeah.
People love having an office dog. Her name is Mocha. She's an angel. People love
Yes.
that. So
Yeah,
yeah.
Mocha is very well behaved and such a awesome addition to the office. I forgot about Mocha. I'm a big dog person. Becky will
Yeah.
tell you. By the way, people hearing me reference Becky. Becky's my wife and also works with Dr. Alice. I don't think I said that, so because people are scratching their head. But yeah, I remember Becky calls me the dog whisperer because I love dogs and it definitely adds a nice touch to the office experience. One of the things too, you mentioned the postcards, and I noticed this as like one of the ads on the postcard is talking about Invisalign. I believe that was the offer that you have.
Mhm.
Let's talk about that because I know that's something that you really is a from what I can tell like a core service that you offer. Um, for somebody that is looking to that needs some work on their teeth and straightening, why Invisalign and what's the benefits of going with Invisalign?
Mhm. Well, Invisalign is great because, they're clear liners. They're practically invisible to most people. and it's just way more convenient. And most adults don't want to be in braces for years on end. So Invisalign
Right.
is a much more efficient solution.
Yep.
You can still eat, speak, and do your day-to-day normally, and it's a lot faster. So that's a huge plus. Yeah, I essentially brought Invisalign into the office as well. I mean, there were a few cases here and there when I bought the office, but I definitely make that a core service that we offer.
Is there anything that for somebody that is I guess thinking about trying to think of how to answer it or ask this question because I know sometimes people get indecisive about whether or not they want to pursue some kind of a treatment for their teeth. Are there are there situations where it's like, for Invisalign, it's really just a preference. Like you don't have to do it. If you want to do it, you can. But are there ever situations where it's like, you know what, there might be like a health concern here. Like you really need to straighten your teeth, and Invisalign is going to be the best solution for that. What do you see in that? Do you ever see any kind of situations where it could be more of a health issue versus more cosmetic?
Oh, for sure. Yeah, there's a huge range. Invisalign is not just for cosmetics. It can make a huge difference on your oral health and even your systemic health. I would say the most common oral health concern I see is people breaking or chipping their teeth all the time.
Yeah.
It's due to their bite. If they've never corrected their bite, they have a deep bite, which puts a lot of pressure on their teeth. I see a lot more damage happening. So I bring that up to the patient. Again, Invisalign is always an option. I never force it on anybody. I just bring awareness to what's going on in people's mouths. That's why I love having our digital wellness scans so people can really see their mouth, see what's going on, and just go over what's going on in their mouth. And then at the end of the day, you don't have to do anything you don't want to do.
Yeah. Well, that's good to know. It's especially, and this is a good follow-up question to that because I know there are experiences that people can have with dentists where they feel like they're pressured, a little bit to kind of pursue certain treatments. But it sounds like your approach is to more like inform the patient, let them understand the benefits, the risk, and then let them choose. Does that sound
Right.
accurate?
My big thing is just bringing awareness to patients about their oral health. You can kind of gauge if people are interested or not. If they say they're not interested, I won't bring it up again. But some people are interested, and it's a conversation you have. And I would say, hey, if this is something you want to fix, these are your options.
Hmm.
I think I do free consults for Invisalign as well, so we can have spend about an hour going in depth about what the options are and what's best for them.
So you mentioned or wellness scans, and that kind of plays into this whole solution that you offer. Tell me a little bit more about that. What do you uncover with a digital wellness scan? What's that process look like for somebody?
Yeah. I mean, at most dental offices, the dentist comes in, they do their exam, they sound like they're speaking a different language. The patient has no idea what you're talking about.
Yeah.
And even if you tell them, oh, you might have a cracked tooth here. Do you want to look in the mirror? Do you see it? People, they really can't see it. They don't really know what's going on in their mouth. So we use a scanner. So about once a year, everyone gets scanned, and then, their teeth and gums get blown up on the big screen. And they can see every single tooth. They can see if there's cracks, chipping, cavities, gum recession. We even have a time lapse feature, so we'll compare scans and we can see if there's any changes. Like, did this gum recession get worse? Is this tooth breaking down more? So having a visual picture for people is very, very helpful because they
Yeah.
can really see what's going on versus just telling them about something and they're like, sure, I guess there's something going on there, but I can't see it for myself. So having imagery is super important for me.
Yeah, and is that fairly recent? Because I'm familiar with it because I've had my mouth scan, but is that fairly recent technology for dentistry?
We've been around. A lot of Invisalign focused offices will have it because it's super, super helpful for patient education. I don't use it strictly for Invisalign. I really like to use it just for bringing awareness to patients. So not
Yeah.
every office has it. But it's a really nice advanced technology to offer to patients.
Yeah, it's incredibly accurate too, in how the just the detail that it shows
Oh,
your
it's
mouth.
really detailed. Yeah.
Yeah, and it's not overly I'll speak from the standpoint of the patient having had a scan done. I know sometimes when whether the hygienist or dentist, whoever's like, all right, we're getting ready to do something in your mouth, like, oh gosh, this is going to be very uncomfortable or painful. It's really not that bad. It's not anything that's very uncomfortable. So, um,
Mhm.
always feel like that about x-rays whenever you have to put that on the bite wings, I guess. Is that what you call them? The things that, yeah, they kind of scratch in your mouth a little bit. So this is definitely a lot more comfortable in terms of the experience.
Mhm. Yeah, before scans, you would have to take impressions. So you have like goo all over your face, you're
Yeah,
gagging, it's a mess. So people really like not having to do that.
right.
Yeah,
Yeah. Yeah, definitely a big upgrade.
for sure.
What kind of advice would you give to somebody? And I'll go ahead and say the first one, flossing, because I hear it every day having a wife that's a dental
Yeah.
hygienist. But like for people when it comes to just caring for their teeth and keeping their mouth healthy and focusing on oral health. Um, is there anything that you would offer as far as just some advice there for people just in maintaining that health for themselves?
I mean, of course, going to the dentist is important. That way we can take a look, make sure there's no, disease like gum disease, cavities going on. And the biggest thing is just making a habit of taking care of yourself. This might be an unpopular opinion, but I don't really care if you floss
Okay.
because
Yeah.
you're not going to floss, you're not going to floss. Like you've been told a million times you should floss, but are you going to floss?
Yeah.
Probably not. I'm not going to talk about flossing because it's almost like you're going to do it or you're not going to do it.
Right.
Brush your teeth twice a day and just see your dentist, just keep it simple. It's not rocket science, you know.
Yeah. Yeah, well, and I appreciate that insight as far as, especially with flossing and um going to the dentist, getting that, every 6 months, getting your checkup and everything. It's certainly important. And yeah, I just didn't know if there was anything else that could be missing there, or any kind of unconventional, I guess, approach to or thoughts around oral care that might, be helpful for somebody. But the basics are the basics, and
Yeah.
yeah. So,
Pretty simple at the end of the day. Just see your dentist, brush your teeth, avoid sugar, you know.
are there any um are there any treatments, or I know you're in cosmetic dentistry and you do cosmetic work. So like what are some options that maybe people don't think about when it comes to improving their smile and things that you see commonly show up in people that you think would be helpful for somebody to know as far as an option for dental care?
Yeah, I'll have some people come in asking for veneers. Um, but really they just have teeth that are really misaligned and that's what's causing a lot of the issues. So I always tell people, get your teeth into the best possible, healthiest position first because, you can get veneers, but veneers can break as well. They're still man-made materials, your
Yeah.
natural teeth, they're the hardest substance in your body. So if you
Hmm.
can break a tooth, you can break a veneer or a crown. So getting everything into the best health is really important. So, you know, that's why I say, Invisalign is not for cosmetics only. It can make a huge difference in your oral health, getting your teeth into a healthy position, getting
Mm.
your breath correct. Once you get everything aligned properly, then we can discuss more of the cosmetics. But I don't want to jump into doing crowns and veneers and they're going to be breaking within a few years because your bite isn't, in a traumatic position.
Mm. That's good to know. I didn't realize, I never thought about that as far as the alignment and positioning of your teeth needs to be set correctly first, and then you can actually start working on cosmetics.
You want the work to last, you gotta make everything healthy first. And that includes your bite, the positioning of your teeth. It can even make a difference if you have sleep apnea. There's so many different benefits.
Okay, so sleep apnea um, is something that's connected with oral health. Is there any other kind of disorders like that that's connected to oral health that would be good for, like if somebody is experiencing it, they might not be making a connection of, oh, well, if I actually fix my oral health, then
Right.
that's going to probably help fix this disorder. Is there anything else outside of sleep apnea that you see?
Um, I mean, those are the big ones, just sleep apnea, preventing more unnecessary wear and tear in your teeth, and of course, cosmetics. I can't think of anything else
Okay.
right.
No, that's fine if there is. I was, it just made, it just,
Those are the
it got
main
me
ones.
thinking.
Yeah,
Yeah, it just got me to think that, well, maybe there is something like sometimes
yeah,
I've lost some weight since then, but and that was the driver of it, but I used to snore really bad. And,
yeah.
and in my head, I'm thinking, well, maybe there's something going on with my teeth that could be contributing to the snoring that I'm not even thinking about.
Yeah, most people have no idea that the way your teeth in your mouth is shaped can actually really affect your systemic health. So, some people have really narrow mouths, very small mouths. So there's
Yeah.
really like no space for their tongue. So then their tongue naturally falls to the back of the throat. You can't breathe at night, have sleep apnea.
Mm.
So a lot of people have sleep apnea and are not aware of it. I wish more people could get sleep tests. Unfortunately, in Virginia, dentists can't prescribe sleep tests, but I wish I could. So I think that could make a huge difference in people's lives. So if I see a person with a very narrow mouth and they're saying things like, "Oh, I snore a lot at night. I feel tired," you know, I'm putting two and two together and I'll show them their scan and I'll go through the scan with them. Like, do you notice how your mouth looks very, very narrow? There's a lot of
Hmm.
crowding. Did you know if we can move your teeth and expand your mouth, your tongue will have more space. You can breathe better at night.
Yeah.
If you can improve people's breathing, there's less risk of heart attack, stroke. It makes a huge difference that people
Yeah.
aren't. Yeah.
Yeah, for sure. I mean, breathing is it's pretty essential to
I want to
life.
breathe at night. Yeah.
Is it so? Let's talk a little bit about because you said that you, as a dentist, you can't, I guess, prescribe like sleep tests, which would make sense. But um, I do understand that from the outside looking in with doctors that they have referral partners or specialists that they refer to. Um, is that what's the strategic partnerships and referral partners like? Explain a little bit about where that kind of plays into your business strategy and how you operate.
Mhm. I love having my specialist. We text all the time about our patients. I personally don't like to do root canals. I don't do a single one. So I
Mm,
refer to my endodontist, which is a root canal specialist, all the time. They're really, really knowledgeable. A lot of people I work with, I actually knew them through school. Like we were all residents together, or, it's all about relationships at
yeah.
the end of the day. People that you can have a good relationship with. Like I go to lunch with them. We can talk about things outside of dentistry. You want to like each other. So it's really all about relationships is where we get the referrals from.
And you, which is something you said that was, which is really cool, is that it's like I don't like to do root canals. So instead of me doing the root canals, I'll find somebody that I can refer to. And that seems to be, it's your practice. So you can kind of choose how you want to package up your services. Um, and then the services that you don't want to offer, you just find a referral partner that you can just, hey, I'll just send those people to you. They need that type of procedure.
Exactly.
Gotcha. Um, well, this is great. I do want to get into now that we're kind of getting near the end here. I do want to talk a little bit about just kind of like the future of dentistry and like let's peek around the corner a little bit down the line. What are some things with technology and business that you see to be something that might be exciting to you down the road in dentistry that and kind of what does the future look like in this space?
Mhm. 3D printing is getting more popular in dentistry. I do same day crowns, and I have a milling machine, which is actually the opposite of 3D printing. So it's a subtractive process,
Mm,
but 3D is, I would say, getting a bigger space in dentistry right now. I'm all about digital dentistry, having a more modern, comfortable experience for patients. And for me, in terms of like practice management, I'm trying to push my practice towards just elevating the patient experience all the time. That's where my promise is going towards.
Now, the patient experience is that on in the office patient experience, or is there anything out of office? Because talking about digital, I don't know if there's any, like, is there any communications or anything that, or like online communications that would play into that experience as well? I'm just thinking, I remember seeing there was some technology out there where like somebody has a, um, what is it? Like somebody has an issue with their mouth. There's like some kind of a video submission that you could send, and there's like communication that can happen between the dentist and the patient that's more remote. Um, is
Yeah.
that is that kind of part of the patient experience that you're seeing with technology, or is it mostly in office?
I mean, I have seen that since COVID, some offices are offering like even Zoom calls for consults. So your patient doesn't necessarily have to be, part of the neighborhood. They could
Yeah.
be thousands of miles away. So I do see that. I personally haven't implemented that yet, but it could be in our future. But definitely like a more digital experience where you don't even have to come into the office is becoming more popular. With Invisalign, there's an option of doing virtual visits as well. So instead of coming into the office,
Hmm.
it's an Invisalign app where you can take pictures and videos of your teeth and your trays. So, making it more convenient for people.
Would that allow you to expand your market outside of the local area with that type of
Oh, for
technology?
sure. Especially if you have like college students, people in the military, who can't come in to their regular visits. So that
Hmm.
definitely can expand your patient pool. I mean, they do have to physically come in at some point, but it does make it more convenient for people who can't necessarily physically come in.
Gotcha. Okay, that makes sense. I wasn't sure if like it's like you're in Ashland, Virginia, but you got patients in California for that one particular service. But there has to be a point where they do have to come into the first, like say Invisalign, for example. Like there does have to be a point where they show up to the office, and then
So it's not completely virtual. Yeah, but it makes the in between visits more convenient.
gotcha. Wow, that's interesting. To think that we're kind of in a time now
Mhm.
where, kind of those virtual remote communications can be even in something like a medical office, like there are now options for people to be able to, get service, even outside of the office remotely.
Yes. Yep.
Yeah, very cool. Okay, well, I want to wrap up here. Just want to ask, like, if anybody wants to get in contact with you and wants to become a patient, like, what would be the next steps for them to get set up?
Sure. Well, our phone number is 804-550-1222. We have our website, atleedentistry.com, and you can find us on Instagram at Atlee Dentistry and on Facebook as well.
Okay, perfect. Well, I'll make sure to link everything up in the show notes. So if you want to get in contact with Dr. Alice and become a new patient and find your dentist here in the Richmond area, Mechanicsville, Ashland area, definitely reach out. And Dr. Alice, thank you so much. This has been awesome. Appreciate you coming on to the podcast and telling us about dentistry and your story. And it's been a learning experience for me for sure. Even though I'm married to a dental hygienist, and I've been around it. It's definitely interesting to hear your perspective on dentistry and how you're growing your practice and the future and the technology and all the things that you're doing.
Thank you so much for having me. It was fun.
Awesome.